Hello, I'm Dr. Maury Markman from City of Hope, and I would like to continue our relatively high level, but I believe important discussion of prognostic versus predictive factors, biomarkers in cancer therapy. Why is it important to go into greater depth in this topic than simply the understanding the definitions? Prognosis sort of says where we are today, what the potential outcome is. Prediction is potentially being able to predict which therapies might benefit. Why do we need to do more than that? First, that definition is important. But secondly, I would argue that today, and certainly in the future, it is going to be important to ask the question of the relative value, clinical value of a focus on developing additional prognostic indicators, prognostic factors, prognostic biomarkers versus a focus on developing more, better predictive factors. Clearly, we have many prognostic factors today we use in clinical practice. In almost every disease entity, we may have multiple prognostic factors, and more are coming. The point I want to emphasize here is that with these increasingly complex algorithms, for example, that are being developed and published by academic institutions generally, demonstrating very nicely, published in high impact journals, that one can define prognosis even more specifically for individual tumor types with the use of these algorithms. One might be able to say, well, we can predict the prognosis today is 20 to 25% 5-year survival versus 15 to 35% because we can really look at these factors more critically, analyze them, even using artificial intelligence to be able to say to the doctor, the patient, the family, this is the likely prognosis. The question we raised is, what is the relative value of that information when one considers the potential cost of these tests? It's one thing to say that we have a marker that can give prognosis that might cost $50 to $100, maybe $200. But what if that test, the use of that algorithm, costs $2,000 or $5,000 or more? What is the real value of that factor? It's a question to be asked. It's a question of the value. I turn to the opposite part of the equation that I'm addressing, and that's the predictive factors. We need to focus extensively, both in the area of precision medicine and in other areas, on factors that can predict clinical benefit for a variety of reasons. One is to be able to predict the therapies that are going to help the patient, simply allow them to live longer, have a better quality of life, but also on the other side, to avoid toxicities for therapies that are ineffective or will be ineffective. So the more precise we are with our biomarkers, our tests, the more we'll be able to improve outcomes, both on the side of survival, quality of life, but also reducing the toxicities of therapy. These tests will also be likely to be increasingly expensive as well, but the justification for being able to give more information on the prognostic side versus the prediction of clinical benefit, which from a cost perspective also would avoid the use of drugs that are not of any value, and that cost, I think you can see where I'm going with this discussion. One focus is going to potentially be great clinical value in contrast to the information that one might get today with increasingly sophisticated prognostic tests alone. I thank you for your attention. And one more segment to talk a little bit about some couple additional considerations in the area of prognostic versus predictive factors. And I thank you for your attention.